Enugu State Governor, Mr. Peter Mba, has flagged off another round of the distribution of palliatives in the state, warning against the politicization of the exercise to ensure it gets to the independent and vulnerable people across the state. According to Mba, the palliatives are a quick fix effort of the federal and state governments to cushion the effects of the economic hardship in the land. Performing the official flag-off after the inspection of the foodstuff, which are largely grains, the governor assured that the items will get to the indigent in the state.
It's the official flag-off of the second phase of the distribution of palliatives, a joint effort of the federal and state government to cushion the current hardship in the country. The governor arrives the venue, acknowledging the people and exchanging pleasantries. He quickly moves to flag off the event and inspect the items for distribution. For him, although the palliatives are quick fix efforts of the federal government and the state to cushion the effects of the economic hardship in the land, his administration has robust programs that will totally eradicate poverty in Enugu State.
This is in line with our promise to achieve poverty eradication. However, this will not be the short, the medium, and the long-term solution. As you know, we have robust program in place which will ultimately ensure that we eradicate poverty and kiss it goodbye forever in Enugu State.
He believes ultimately that those, especially in agricultural and business sector, can create wealth, embracing the available government intervention for them.
Whether in the agriculture sector, in the business sector, those that are providing services, we are poised to ensure that we upskill them. For those in agriculture, we provide extension services to upskill them so they can be able to increase and upskill their production. And those that are in business, we have intervened by providing funds for those in the small and medium-scale businesses.
The items to be distributed are mostly bags of grains, numbering 24,000 bags, with each of the 260 wards in Enugu State getting about 70 bags.
We have about 24,000 bags of rice available now. And the trucks, some of the local government, their trucks are already here waiting for them to be loaded while they dispatch to the various local governments. We have 70 bags of 25 kg of rice per ward.
For the head of the Enugu State Emergency Management Agency, the distribution will be fully monitored by the security operatives to ensure it's not diverted.
We're working together with the HPMs, we're working together with the security men, both DSS, police, the community leaders in the various communities to ensure that this particular item goes down to the poor ones, those who are in need of it. It's not meant for everybody.
As the Enugu State government promises equitable distributions, the people want to see the impact of the robust programs geared towards poverty eradication in the state.
The ability of Governor Alex Otti to finance monumental projects across Abia State has been attributed to the successful adoption of the TSA, that's the Treasury Single Account. The special advisor to Governor Otti on due process, Mr. Oluebube Chukwu, explains that the implementation is giving the state more control of its earnings and revolutionized infrastructure development. Speaking to newsmen in Umuahia, the state capital, the special advisor said the implementation of the TSA has blocked revenue leakages.
When we came here, we tried looking for certain documents, to ensure continuity. They were not there. But in Abia State right now, we have a governor who is a stickler to due process. His Excellency wants to do things professional. He wants to follow the book. He wants to do things by the book. I can assure you, with no iota of doubt or anything, that this present administration in Abia State follows due process in its activities. So it's kudos to His Excellency once again, because for the past 8 years, or even if you like stretch it to 24 years, there was nothing like that. And it's give opportunities for monies to, be lost within the system. But with this TSA now, and it's growing on a daily basis, there is money for the government to engage in these activities. And then the people that gave His Excellency the mandate, they are seeing what he's doing. And having that TSA, which the governor decided that he would implement and he has implemented, has definitely given an edge to the activities that the governor has been promoting and the responsibilities to which he has been discharging, of course.
The House of Representatives has vowed to reverse trending medical tourism to Nigeria, saying there are plans to reposition the health sector through adequate funding. The chairman on health institutions, Mr. Amos Magaji, made the vow during an oversight function by members of the committee at the David Umahi Federal University Teaching Hospital in Uburu, Ohozara, local government area of Ebonyi State.
The vision for the David Umahi Federal University Teaching Hospital as a health center is that it falls in line with the 10th National Assembly's vision to redirect medical tourism to Nigeria. Members of the House of Representatives Committee on Health Institutions believe the big picture is to ensure that people no longer travel out of the country for healthcare services with the infrastructure and medical equipment already put in place in many hospitals, one of which is the David Umahi Federal University Teaching Hospital in Uburu, Ebonyi State. The chairman of the committee, Amos Magaji, and his team are at the institution to find out the interventions needed as the National Assembly is poised to end the brain drain which has ravaged the health sector.
The vision also for this center is in line with the vision of the 10th Assembly Health Institution Committee of redirecting medical tourism back to Nigeria. And that's what this center is meant for, to ensure that people no longer travel out of the country for medical tourism. And we've gone around, we've seen equipment like linear accelerator, MRI machines, CT scan, and of course, dedicated medical staff and so on that are there to ensure that the services are delivered. So what we have seen here is truly impressive.
The management, led by Professor Uzoma Agu, emphasized the importance of the hospital as she appeals for appropriate funding from the federal government to enable the institution to sustain and meet the expectations of delivering healthcare services.
We cannot be described as just that new hospital that is small. This hospital is huge, and because of that, to maintain the standard, we need funding. We need funding, and we need funding. When we have the right amount of funding for this structure, everything, every expectation will be met.
The David Umahi Federal University Teaching Hospital, Uburu, says it's pushing to be at the forefront of healthcare delivery in the country and the go-to medical facility, especially for Nigerians in the southeast region.
3,000 residents of Imo State will be benefiting from the Niger Delta Development Commission's free healthcare medical program in Oguta, local government area of the state. A representative of the NDDC managing director, while speaking at the official flag-off of the week-long free healthcare program at the General Hospital, says over 2 million residents of the Niger Delta area benefited from the program over 3 years.
It's the turn of Imo State in the ongoing free healthcare medical mission of the Niger Delta Development Commission, the NDDC. The program, which runs across 9 mandate states of the Regional Development Agency, is part of its intervention in the healthcare needs of the people. At the Oguta General Hospital in Oguta local government area of Imo State, residents troop out in their numbers to access this free service.
It's so impactful that I'm not sure anybody will want to rival what they have done. Nobody will come near it.
no matter how free it is. This one is something else.
At the various hospital units and wards are patients who are receiving treatments for cases such as malaria, eye surgeries and intraocular lens implantation and dental surgeries, amongst others.
As they have given me this class, I can be able to read the Bible and other books. I want to thank God on their behalf for the good work they are doing, that God will continue to equip them, help them, and reward them.
In the theatre, doctors are carrying out surgical operations for fibroid, appendicitis, joint dislocation, among other things. Mrs. Kate Egwim, whose son has just undergone a major surgical operation, cannot hold her joy.
To NDDs, thank you for what you have done for our children today. I need. Thanks. God bless you people.
My two jaw was broken due to the beating of my sister-in-law with a rod. But by the mercy of God, I was opportune to come here. And the teeth that I wasn't using to chew for the past 4 months, I can now close them properly.
Representative of the managing director of the NDDC explains the success of the program.
We're targeting between 75 to 100 surgeries, giving out between 300 to 350 glasses, and hopefully seeing about 3,000 to 3,500 patients.
He also speaks on a new healthcare scheme by the Commission to further assist indigent residents.
I'm also bringing to your notice that NDDC is trying to register people, now the vulnerable people and children under age 5, so that they will have access to healthcare.
People are coming from far and near to be operated upon, some teeth, some their tummy, some eye. You can see a lot of people saying, thank God for NDDC, thank God for NDDC. And the program is still on.
As the train of the NDDC free healthcare service mission moves to another state, the Commission says it will surpass the 2 million people who had previously benefited from the program.
As part of activities lined up to mark the 2024 Workers' Day celebration, civil servants in Anambra State are creating time for medical checkups to ensure maximum safety and productivity. The managing director of the State Health Insurance Agency, Dr. Simeon Onyemechi, advised the workers to ensure that they go for medical checkups for a better and healthy living.
The venue of the screening and sensitization program by the Anambra State Health Insurance Scheme, ASHA for state workers, Anambra State, is at the Teacher's House, Awka. Civil servants gathered to be part of an exercise that gives them a sense of belonging and inclusion ahead of the 2024 May Day celebration. The program, organized in collaboration with the Nigeria Labour Congress, is aimed at preventing both primary and secondary health challenges, as well as scale-up efforts towards achieving universal health coverage in Anambra State.
As we are serving our state, we face a whole lot of challenges. Everybody knows that. And one of the major challenges that we face as workers in the state is the issue of health. Health. We often hear that health is wealth. If you're not healthy, you can't even serve the state properly.
The managing director of the Anambra State Insurance Scheme, Dr. Simeon Onyemechi, reminds the workers of what the insurance scheme is all about.
You usually got these requests to contribute some money to pay hospital bill for a colleague of ours at work has drastically reduced, if not completely eliminated, because the state government now has this health financing mechanism to take care of us when we are sick.
He also educates them on the need for constant checkups. And on trying to find out how often the workers engage in medical checks, he gets a not-so-encouraging response. The screening exercise then commences.
Okay, have you checked in the last 3 months? In the last 3 months?
The exercise is a step in the right direction as healthcare is now made accessible to everyone in the state.
And everybody has to keep making efforts to check their different statuses. Now, people have started taking this seriously. More importantly, because of the fact that we now have an insurance scheme whereby people don't have to pay those astronomical hospital fees in order to have their health taken care of.
When you give attention to the health of workers, their productivity, the output will be very high. And that's why I said, they say that all works and no play makes Jack a dull boy. But in this time, that we are going to engage our workers with the government already established a health agency called ASIA.
It's in line with Governor Chukwuma Soludo's blueprint on health, as the healthcare needs of over 1,000 workers are being taken care of in the exercise.
With the turnout, we have seen about 1,400 civil servants having this done today at the cost that we have put in. We are very excited that we will prevent a lot of diseases and detect a lot more earlier in such a way that ultimately the agency will spend less because of issues around primary and secondary prevention that will go in ultimately to save us costs and then ensure that we can, on a sustainable basis, cater for the healthcare needs of our people.
The Anambra State Health Insurance Scheme was launched on 14 September 2018 after the law establishing its enactment was passed in 2016. The mandate is to provide quality and affordable health care to Anambra citizens, and the agency is living up to its bidding. For more on the health insurance scheme in Anambra, Dr. Simeon Onyemechi, Managing Director of the State Insurance Scheme, joins us now from Awka, the state capital. Hello and welcome to the program. Thank you for joining us.
Thank you so much. Good afternoon.
Yeah, quite a turnout there, but in practical terms, how does the State Health Insurance Agency ensure that civil servants receive comprehensive healthcare coverage that meets their needs, considering factors such as age, pre-existing conditions, and specialized medical requirements?
Yeah, thank you so much. Just to say that ours is a scheme that mirrors clearly from the point of conception all of the contextual diseases that we have here. The health burden locally here in Anambra was clearly taken care of in developing a benefit package. The comprehensive service delivery package which we have ranges across all age groups for pediatric needs, maternal child health care needs, even up to the point of geriatric disease needs. We have ensured that looking at our disease burden as a state, that what we have included in our benefit package covers at least 80% the needs for the reasons for why our people go to hospital on a daily basis. What this has done for us is that across the spectrum, whether surgical needs, obstetric gynecological needs, internal medicine needs, pediatric needs, and what have you, Anambra State Health Insurance have an actuarially determined benefit package that has attempted clearly in the last 6 years since we have started operations to cater for the needs of our population, whether it's eye care needs and what have you. So the range of services, whether it's health promotion, health prevention, curative care, and some bits of rehabilitative care. The only exception at this point, which we haven't gone into, is issues around cancer and its management. But then the screening and detection of issues around cancer, we have also included in our benefit package. But then what we have applied is to say, at the beginning, when we designed this benefit package, with a strong political will of the state government, we put into it the principle of universal, progressive universalism, where we started small in our benefit package, and over time, as the scheme got stabilized in the last 6 years, we have gone ahead to include services that range to high-end investigations like magnetic resonance imaging, computer tomography, that's CT scan, and what have you. We have included things like prostatectomy for elderly men who will need them, for women who might need hysterectomy, that is to remove their womb completely, for things like dysfunctional uterine bleeding and some other conditions for which, to save the life of a woman, you must get the womb out. even simple things like fibroids. I don't want to get into issues about around cesarean section and what have you. No woman has any business, any reason to die from childbirth in Anambra State. So the state government has, in such a manner, funded the scheme sufficiently to ensure that there is subsidy given by the to offset the healthcare bills from the little contribution which both civil servants have to make from their salaries that are deducted and then remitted to the agency on a monthly basis, as well as for those who are in the informal sector. So suffice it to say that at this point, for the over 200,000 beneficiaries of our scheme in Anambra, active beneficiaries, our benefit package has sufficiently taken care of their needs, because we know clearly from epidemiological trends what the disease burden is in our state here. So the basic things have been taken care of, and then over time, like I had said, with the principle of progressive universalism, we have tried to expand our benefit package to cover a lot more reasons why our people go to hospital, so that when you earn monies, you do not have to put it into leaky holes that healthcare needs will consume. But rather, you earn these monies and then you rather take care of yourself, because the state has given you financial risk protection. And those who do not have these needs, those who are already poor, the benefit package is such that we are able to prevent people from falling further into poverty.
And that's quite expansive. Quite expansive there. You said 200,000 beneficiaries. I'm wondering if that's the size of the workforce of the Anambra State government, when you consider the state secretariat, the ministries, departments and agencies, and the local government officials as well. I wonder if that's the size of the workforce, and what provisions are on ground to make this regular screening regular and accessible to all workers of these categories that I've outlined.
Yeah, thank you so much. Actually, what we have here, we have a formal sector program for the civil servants. We have informal sector program for those who are not employed by government. Anambra State Health Insurance Scheme Law 2016 makes health insurance mandatory for every resident of Anambra State. But to the extent to which this mandatoriness has been enforced, for the fact that you will think of the chicken and the egg, which one comes first. Enforcement government is being very pragmatic and sensitive to the realities of the day economically in enforcement. But of these about 230,000 enrollees, the civil servants population accounts for just half of that. A lot of private individuals, truck pushers, carousellers, the farmers in villages, because here in Anambra there's what we call adoption model, which is indigenous to us. And every other state across Nigeria today have come to copy that from what we do here, where we pitch to people, philanthropists, to say, exploring the social and socio-cultural ties that we have here to get our people who are philanthropic in nature to pay health insurance premium for others. So in Anambra, we have that over 60,000 persons from the informal sector, people who ordinarily may not be able to pay health insurance bills. People now do Christmas charities with payment of insurance premium. At 12,000 naira, if you reside in Anambra, you will get cover for a full year. And all you now need to do is, when you get to the healthcare provider of your choice, over 250 of such accredited healthcare providers in Anambra, you get these services and pay just 10%. So the civil service population, by about 50% of our clients at this point. Now, what we have done is to say, among civil servants,
indeed,
go to facility.
There's a lot of prospects there from your explanation, but we're totally out of time. I must apologize. We're totally out of time. We look forward to having you on another edition of the program so that you can expand further on the coverage of the Anambra State Health Insurance Scheme. Dr. Simeon Onyemechi, thank you so much for your time on the program.
Thank you. I appreciate it.
And that's it on the program today. Thank you for watching. Join us again tomorrow when we'll bring you another edition. I am Bukola Koka. Bye for now.